On behalf of UT Benefits, welcome to the University of Texas system. We're here to share information about your benefits program, including eligibility and enrollment, basic and voluntary coverage, and helpful resources. You can find detailed information in the Employee Enrollment Guide at utbenefits.link/EMP Enroll Guide and on the UT Benefits website at utsystem.edu/benefits. The UT System Office of Employee Benefits administers the UT Benefits program, working collaboratively with all the UT System institutions. Around 300,000 employees, retirees, and eligible family members participate in the UT Benefits program. Benefits eligibility and enrollment. Under state law, you must meet specific criteria to be eligible for UT Benefits coverage. For full-time employees, you must work at least 40 hours per week or have a full-time appointment. Your institution may also designate employees expected to work at least 30 hours per week as full-time for the purpose of insurance eligibility. For part-time employees, you must work at least 20 hours per week or have at least a 50% appointment. Additionally, all employees eligible for the plan must have an appointment expected to continue for at least 4.5 months, be eligible to participate in the Teacher Retirement System of Texas or the Optional Retirement Program, and must not currently be insured by another state of Texas-sponsored medical insurance plan. Certain non-employee postdoctoral fellows and qualifying graduate students who do not meet these requirements may also be able to enroll in benefits. Please contact your institution's HR or benefits office with eligibility questions. You can also enroll your eligible dependents in several benefits. Eligible dependents include your spouse, your children under 26 years old, and certain children over 26 years old who are determined by the Office of Employee Benefits to be medically incapacitated and unable to provide their own support. The UT Benefits website includes a complete list of eligible dependents. You have an initial benefits enrollment period of 31 days from your first day of benefits eligible employment. Your employment start date and your institution's policies determine when your benefits begin. You can also make benefit coverage elections during 2 other periods. You have a yearly opportunity to make benefit elections and changes during annual enrollment. It's from July 15th through 31st, with the new plan year beginning on September 1st. An employee or dependent may also experience a qualified change of status event, allowing them an opportunity to update certain benefits during the plan year. Examples are a new child, a change in marital status, or a move to a benefits-eligible position. Sign on to the My UT Benefits platform to make your coverage elections. Visit utbenefits.link/manage for your institution's platform link and sign in with your campus ID and password. Some elections require evidence of eligibility, evidence of insurability, or evidence of waiver documentation. You'll submit any required documents directly in My UT Benefits. Basic Coverage Package. Benefits eligible employees are offered the Basic Coverage Package. It consists of subscriber-level UT Select medical and prescription drug coverage, a $50,000 basic group term life policy, and a $50,000 accidental death and dismemberment policy, often called AD&D. The state of Texas and your institution contribute premium sharing funds to pay for some or all of the cost of your basic coverage package and a portion of any dependent medical coverage. Be sure to inform your institution's HR or benefits office if you or a dependent are being covered under another state-sponsored medical plan in Texas. That's because you cannot receive premium sharing funds from 2 sources at the same time. If you're a full-time employee, premium sharing covers 100% of your basic coverage package and about 50% of the premium for your dependent's medical coverage. If you're a benefits-eligible part-time employee, including eligible graduate student employees, premium sharing will cover 50% of the cost of your basic coverage package and up to 25% of the premium for your dependent's medical coverage. Institutions may choose to supplement premiums for their graduate student employees. Find your premiums at utbenefits.link/EMP premium sharing. If you are a benefits eligible employee and can provide proof of current group medical coverage from another source, excluding state of Texas sponsored coverage, you may take a premium sharing waiver. You can waive the basic coverage package and use the state's portion of premium sharing to purchase vision, dental, and voluntary AD&D coverage for you and your eligible dependents. Please note that if you waive the basic coverage package, you will not be enrolled in medical, prescription, basic life, or basic AD&D coverage, and you will not be eligible to participate in the UT Living Well programs. Medical coverage. UT Select is a self-funded preferred provider organization plan, or PPO. It allows participants access to a substantial network of Blue Cross Blue Shield of Texas providers and facilities. You can receive care from any licensed doctor you choose with no referral required. If you visit an in-network provider, you will receive the higher level of benefits and pay less out of pocket than if you see an out-of-network provider. We'll highlight a few plan details here, but for more benefits information and medical plan terminology, please review the UT Select Plan Guide. It's online at utbenefits.link/UT Select Guide. The annual deductible for in-network benefits is $600 for an individual and $1,800 for a family. The plan offers $30 primary care visits and $50 specialist visits for in-network in-area services. Participants pay no out-of-pocket costs for preventive care or lab and x-ray services associated with office visits. Plan members can access the UT Health Network. It's an enhanced plan design with lower copays and coinsurance when you receive services from certain UT providers and at certain UT facilities. UT Select members have unlimited access to free virtual visits with MD Live. You can receive care when and where you need it, 24 hours a day, for several non-emergency medical conditions. You can also book no-cost virtual behavioral health appointments with a licensed therapist or psychiatrist. Your plan includes several other value-added services with no out-of-pocket costs. Blue Cross Blue Shield Health Advocates offer personalized, concierge-level customer support when you need assistance. They can connect you to condition management services, help you find an in-network provider, and much more. Hinge Health helps members conquer chronic pain without surgery or drugs. Wonder Health teaches skills for weight management and a healthy lifestyle. And Ovia offers support during fertility, pregnancy, parenting, and menopause journeys. Your prescription drug coverage is administered by Express Scripts. Each member has a $200 annual prescription deductible, which is separate from your medical plan deductible. The UT Select Guide includes a chart of your prescription drug plan benefits. UT System is committed to promoting a culture of wellness and disease prevention and recognizes the costs associated with treating tobacco-related health conditions. Because of this, UT System implemented the Tobacco Premium Program. UT Select members who use tobacco products or e-cigarettes pay an additional surcharge of $30 per month with a maximum family surcharge of $90 per month. You'll declare your tobacco status when enrolling in benefits. Premiums collected through the program go towards additional wellness opportunities for the UT community. Voluntary coverages. UT Benefits partners with several vendors to bring you optional coverages. You have 2 vision plans through Superior Vision, both giving you access to eye exams, glasses, and contacts. You may choose one of 3 dental plans with Delta Dental, including an HMO plan available in select parts of Texas. UT Flex spending accounts help save you money. With the healthcare reimbursement account, you can set aside pre-tax income for healthcare expenses like copays, prescriptions, and health supplies. Use the dependent care reimbursement account for expenses like daycare, after-school programs, and elder care. You may enroll in one or both flex spending accounts. To prepare for unexpected circumstances, Blue Cross Blue Shield of Texas Ancillary offers voluntary group term life insurance, voluntary AD&D, short-term disability, and long-term disability coverage. If you are considering voluntary group term life insurance or disability coverage, your initial enrollment period may be an ideal time to sign up. That's because you won't need to complete evidence of insurability documentation for voluntary group term life insurance up to 3 times your salary or disability coverage, but it is required for future enrollment periods. Dental, vision, flex, and AD&D coverage never require evidence of insurability. Learn more about each voluntary coverage before you enroll. Visit utbenefits.link/yourutbenefits for details. Voluntary coverage premiums are paid by the employee. Find a chart of your monthly premiums at utbenefits.link/premium rates. UT Retirement Savings Plans. The University of Texas system provides many ways to save for your retirement. The 2 mandatory participation plans are the Teacher Retirement System of Texas, TRS, and the Optional Retirement Program, ORP. As a benefits-eligible employee, you will participate in one of these 2 plans. TRS is a defined benefit plan. This plan is for all benefits-eligible employees, and you are automatically enrolled unless you are eligible for and elect ORP. ORP is a defined contribution plan. It's an alternative to TRS for certain qualified employees based on their position. Those eligible are notified by their institution and have a one-time, irrevocable opt-in period for the first 90 days of eligibility. In addition to your mandatory retirement plans, the UT Saver voluntary retirement programs are a great way to save up for a healthy and fulfilling retirement. Except for contract employees, anyone receiving a paycheck can participate, and you can enroll in UT Saver programs at any time. The UT Saver plans are the 403B tax-sheltered annuity and the 457B defined contribution plan. You may contribute money before taxes to lower your taxable income now, or after taxes for a tax-free distribution later. Compare your options and learn about your authorized retirement providers in the Employee Enrollment Guide. The UT System Living Well program offers resources to support employees and their families in leading happier and healthier lives. UT Select members can take advantage of several Living Well options throughout the year, like seasonal wellness challenges, tobacco cessation resources, discounted fitness programs, and digital self-paced behavioral health courses. UT Living Well includes the Employee Assistance Program, or EAP for short. It's a confidential service available through your institution at no cost to you to help manage personal and professional challenges. Sign up for the UT Living Well platform powered by Limeade to stay on top of wellness offerings, connect with colleagues, and find personalized activities to meet your wellness goals. It's available via browser and the Limeade One app. Learn more about wellness programs at utbenefits.link/livingwell. Additional resources. Find contact information for your HR or benefits office at utbenefits.link/HR contacts. To speak with insurance plan administrators, visit utbenefits.link/contacts. Connect with us on Instagram, Facebook, and X to learn about ways to utilize your benefits. On all platforms, we are UT Benefits. To all employees and their family members, UT Benefits looks forward to being there for you. From our office to you, welcome to your UT Benefits.